Down through the centuries, the notion that life is wrapped in a dream has been a pervasive theme of philosophers and poets. So doesn't it make sense that death too would be wrapped in a dream? That after death your conscious life would continue in what might be called a dream body? It would be the same dream body you experience in your everyday dream life, except that
some crazy stuff started happening where I started losing weight. I started drinking a lot of water all the time and just having a really bad attitude. It wasn't me. My parents brought me to the doctor and I found out that I had diabetes, type 1, and my blood sugar was over 700. For those of you who don't know, normal's anywhere between 70 to 120. And finding out was crazy because I really had no idea what it was. And first thing I asked was, am I going to die? And the doctor said, no, you'll be fine, but you have to go to the hospital for a couple days. So went to the hospital, and we went through like extensive training on what diabetes was and how to manage it and take care of it and all that stuff. And it was crazy, crazy time.
What are the 3 types of diabetes?
Being juvenile diabetes, which affects juvenile individuals, 18 and younger. And then you have diabetes type 1, which is diabetes that requires insulin injections because the pancreas no longer provides enough insulin for the body to be able to do its process. And then you have type 2. Type 2 diabetes is to where the pancreas and the aisles of Langerhans is still able to produce insulin, except it doesn't know when to release as much insulin. Type 2 diabetes, they take a pill at a certain time of day, different medications that they have, and these pills are made specifically to tell the pancreas to release more insulin. So whenever they take these medications, it adjusts the dose of insulin being released. Predominantly, these are done prior to meals. Diabetes is not just about sugar, it's about carbohydrates also. Many of the carbohydrates in your body that your body consumes, your body turns them into sugar. That becomes a problem. It's worse than eating sugar.
It accounts for approximately $175 billion per year in health costs. Type 1 diabetes is caused by one's own immune system destroying the insulin-producing beta cells of the pancreas. And this results in metabolic derangements, which have acutely life-threatening as well as long-term life-limiting consequences. Type 1 diabetes is not caused by personal behavior. It's an outcome of the accident of genetics colliding with a yet-to-be-understood group of environmental circumstances. If type 1 is not diagnosed quickly enough or left untreated, you die. And even though insulin replacement injections can keep us alive, it is a difficult life, and it is very hard to get it right.
Hi, I'm Erica Shepard, and I'm a CVS pharmacist. Coping with a diabetes diagnosis can be incredibly difficult. It can be emotionally and physically draining to realize you need a plan for managing the disease for the rest of your life. According to the American Diabetes Association, it's not unusual for people diagnosed with diabetes to respond with denial, anger, and depression. These initial reactions are so common that you shouldn't feel ashamed if you have them, but your job is to make sure these attitudes don't stand in the way of your health. Eventually, the normal negative reactions to your diagnosis should give way to acceptance, but there are some things you can do to help you cope. First, you should take control of your blood sugar and exercise regularly, ideally up to 6 times each week for 30 minutes to an hour. The healthier you are, the better you'll feel both emotionally and physically. Share your feelings about your disease with your doctor, diabetes educator, family, or friends. Many community hospitals sponsor diabetes support groups where you can share tips and talk with other people who are coping with the disease. The American Diabetes Association lists names and contacts of support groups in your area on their website. If you're dealing with a lot of anger, think about what makes you angry and consider keeping an anger diary. If anger persists, consider visiting a counselor, therapist, or other mental health professional. Depression, when it occurs, should be treated right away. Several studies suggest that diabetes can double the risk of depression. Some people feel depressed immediately after learning they have diabetes, while others face the problem down the road after years of trying to control it. If you feel depressed, seek professional help right away. You can learn how to cope with your diabetes diagnosis. If you have any questions, talk to your CVS pharmacist. We're here to help.
Diabetes may seem complicated, overwhelming, and scary, but by following proper diet and exercise schedules, we can take a step towards managing and finding a cure for diabetes. Organizations such as the Dakota Coalition for Diabetes and the American Diabetes Association will work diligently to find a cure.
The sticks and stones.